allergy shots are about 80% effective.
Hi, everyone. Today we're talking allergy shots with a board-certified allergist and immunologist, Dr. Salima Thobani. She practices in Southern California. So let's get right into it. Do allergy shots work?
So allergy shots have been around for 100 years. And I'm always floored when I'm like talking to my friends and people and they're like, what? There's shots? You can get injections? And I'm like, yeah, you can get injections and they actually work. It's the one thing that I call is disease modifying, which means I'm not just giving you a medication and say, here it is for the rest of your life. There is a treatment plan, 3 to 5 years of shots. And I don't promise people that they get off their meds, but most of my patients get off their meds. Their quality of life is back. They can breathe, they can smell. Allergy shots are about 80% effective. So not 100%, right? But 80% it's a pretty good odd, right? That these will work for you.
And the other 20%, is it partial effectivity or just nothing?
No, there is partial effectivity. Now, the idea is that we say it's a 3 to 5 year treatment plan, then you're done. And what we're doing is slowly over time. So you're coming in weekly for about 8 months to a year. And then you're coming in monthly for 3 to 5 years. And what we're doing is we're slowly educating your immune system to stop producing inflammation. So say you're allergic to dust mites in dogs. I'm going to be injecting you, or my nurses will inject you with anywhere between 1 to 4 injections, depending on what you're allergic to. It's not a vaccine shot. So it's not going into the muscle. It actually doesn't hurt. That's why we have kids that are on it. It goes into what I call the subcutaneous fat, right? It's cushioned. I think the pinch from like my nurse is pinching the arm to put the needle in hurts more than the actual needle. Goes into the arm. And it goes into your lymph nodes and it educates the lymph nodes to produce what we call antibodies that do not want to produce inflammation.
And what's the timeline for noticing improvement?
That's a great question because this is not a magic, like, oh, I got a shot, tomorrow I'll feel better. I tell patients you have to do it for about a year before you see efficacy, right? And that's a long time to try a treatment plan before you're like, okay, it's not working for you. And I think that's probably one of the downsides of allergy shots is that there is so much time that the patient has to give up.
Is there a specific type of allergy that is more useful to be treated with allergy shots than another type?
No, we treat everything. And now we're also doing sublingual IT. It is, patients can do it from their home. It only works if you're like monosensitized though, right? Like, so if you're just dust allergic, I can offer you dust tablets. So you come in, you get the first dust tablet in our office to make sure you're not going to have a reaction. And then you pop one in your mouth every day. And that works well for people who can't come in. We also have a grass tablet and a ragweed tablet on the market right now. But most patients I find are polysensitized. So they're not just allergic to one thing.
Could you do multiple tablets?
No, it's not recommended. Anaphylaxis, higher risk. And, as it is, allergy shots, when you come in, we're watching you for 30 minutes because of that risk of anaphylaxis.
Okay. But for food allergies, there's no allergy shots.
There's not. And they've looked at it. They were just, the risk of anaphylaxis injecting the foods it's too high.